Hi friends, I am Dr. Dhananjay Singh. I will present you today topic which is antigen, which is related to microbiology subject of MBBS and BDS subject. If you are new in my YouTube channel, please subscribe my channel and tap the bell icon for first video watching. I will start antigen definition. An antigen is a substance which, when introduced into a body, evokes immune response to produce a specific antibodies with which it reacts in an observation manner. Antigen, it is a substance which reacts in body, which forms activate the antibodies in body, and antibodies kill the antigens. First is type of antigen. These may be classified as complete antigens and haptens or incomplete antigens. Haptens are two types: complex haptens and simple haptens. A complete antigen, these are substances which can induce antibodies formation by themselves and can react specifically with these antibodies. Complete antigen substance induce antibody formation, which is induce the antibody formation themselves and react specifically with the antibodies. What is the haptens? Haptens are substances unable to induce antibody formation. Haptens no induce antibody formation its own but can become immunogenic, capable of inducing antibodies when covalently linked to proteins called carrier protein. When haptens which link to protein and then it is called carrier protein. However, haptens can react specifically with induced antibodies. When haptens react specifically antibodies to form the carrier protein, antibodies also react with carrier protein and haptens. These antibiotics are produced not only against the haptens but also against the carrier protein, which antibodies form in the body by the antigens of haptens, which also against the form of antigen of carrier protein. Complex haptens can combine with specific antibodies to form precipitate, example capsular polysaccharides of pneumococcal. Simple haptens combine with specific antibodies but not precipitate is produced. This is due to a univalent character of simple haptens, whereas complex haptens are polyvalent. Simple haptens are combined with specific antibodies which form in our body and no precipitate produced. This is due to univalent character. The antibodies is the character univalent character which is simple haptens. Examples: proantigens are low molecular weight substance which do not induce antibody formation but can cause delay hypersensitivity reaction. Example: dinitrochlorobenzene, which is known as DNCB. Proantigens are low molecular weight. It is molecular weight very low substance, do not induce antibody formation, can cause delay hypersensitivity reaction. And antigen and determinate epitope is the smallest unit of antigenicity. The smallest unit of antigenicity is known as epitope. The combining site is on the antibodies molecule corresponding to the epitope is called the paratope. The combining site antibody molecule corresponding epitope which is called the paratope. This is the figure which is difference between the antigen and antibodies. This is the antigen molecules and the antibody A and antibody which is attached antibonding sites, which is specific structure of antigen, and this structure is the antibodies, which is the two chains, which is the light chains and heavy chains, which is attached with sulfur bonds and variable regions, which is the same sites with the antigen binding sites which attach the antigens. And this structure is most important. Factors of antigenicity. Which factors antigenicity cause? The first is foreignness. What factor come in our body? Foreign factor, which is the foreignness. In size of antigen, which size is antigen in our body is enter. Chemical nature, susceptibility to tissue enzyme, antigenicity, specificity, and specificity, which species is antigen specific. Isospecificity, autospecificity, and organ specificity, which organ is caused the antigen is the specific organ. Heterophilic specificity. Weil-Felix reaction and Paul-Bunnell test are based on the presence of heterophilic antibodies. Weil-Felix reaction and Paul-Bunnell tests are based on the presence of heterophilic antibodies. Forceman antigen. It is the lipoprotein polysaccharide complex widely present in man, animals, birds, and bacteria. It is the lipopolysaccharide complex. It is complex of lipopolysaccharides which is widely present in animals, birds and bacteria. Superantigens. What is superantigens? Which is meaning incorrect. And superantigens are molecules that can interact with antigens presenting cells. Antigen presenting cell, which is APC. The superantigens are molecules that interact with the antigen presenting cells and T lymphocytes in a non-specific manner. T lymphocyte cells kill the antigens, which is phagocytosis process, and it is very important cells in our body. These antigens do not involve the endocytic processing as required in typical antigen presentation. This antigen not involve any endocytic processing required typically antigen present in our body. Staphylococcal, enterotoxins, exophilitis toxin and some viral proteins are examples of superantigens. Today's topic is end, and if you like these videos, please like. Any doubt and question, please in comment box and share more videos. Thank you.